Health Alert is brought to you by OU Physicians in Tulsa. Hello, welcome to Health Alert. Today we're going to talk about issues related to our general health, and joining me is Michael Montague. He's a physician assistant at Morton Comprehensive Health Services. Welcome.
Thank you.
Now, before we start to talk about some of the general health issues that I want to focus on, tell us about being a physician assistant, because you are a PA or physician assistant. How do you become one, and then what is the scope of what you really do?
Okay. A physician assistant is a licensed medical profession that works with under a doctor's supervision.
Okay.
Okay. We can provide general physical examinations, a diagnostic lab, order medications, also x-rays.
Okay.
We assist with surgeries in hospitals also. And physician assistants can generally work within the scope of what the physician supervisor does. In other words, if he's a gastroenterologist, then we can do that sort of specialty also.
So you're kind of like an extension of the physician.
Exactly.
So when people may come in for services, they may initially see a physician assistant, but that's not less than seeing the doctor, because sometimes as consumers, we're always thinking people are trying to shortchange us. But seeing the physician assistant, once again, you're able to do the same level of comprehensive care in your area, and the physician is there to assist or intervene as is needed. And you're consulting all the time.
Exactly. We're consulting all the time, and any complex case, we can also refer that to the physician supervisor.
Okay, now let me ask in terms of preparation, because some people may think this is an exciting profession.
Yes.
How do you become a physician assistant? Is there college involved?
Yes.
Is there a physician assistant school?
Yes.
Exactly. What do you do?
Yes, there's actually two physician assistant programs in Oklahoma, the University of Oklahoma and Tulsa University.
Okay.
The general prerequisites nowadays are a four-year college degree with at least 2 years of science, and the programs usually run on an average of around about 27 months. We also received about 2,000 hours of rotation in specialty areas.
Okay. Now, with a physician assistant, in terms of the course of study, you did mention that you have a four-year degree, a baccalaureate degree, before you go into that program. Sometimes we want to know, do you have to specialize? You did talk about the science part, but do you have to specialize in in terms of your major in college being biology or chemistry, or could it be general education?
It can be general education, but you do need the science courses. And I also must add that they generally are looking for some medical experience.
So something being a paramedic,
being a paramedic, certified nursing assistants, a lot of Navy medics and Navy corpsmen.
Okay, gives you kind of like an upper hand, but not a have to.
That's right.
Okay, now let's look at physician assistants then within the Morton structure.
Yes.
I want to start talking about, you work in family medicine, correct?
Right, I work over at the East Tulsa Family Health Center.
Okay, and then when we talk about family medicine, then we're talking about all age ranges that you actually assist with their health care.
That's correct.
Okay, now in looking at this, I want to talk about allergies.
Yes.
Because even now my eyes are affected by the allergies. It seems to me to be an all-year phenomenon, not just one time during the year.
Right.
Tell me a little bit about allergies and what you're seeing in terms of coming into you for assistance. Like I said, I got the eye thing going, but what do you see?
We like to say Tulsa has two seasons, flu seasons and allergy seasons.
Okay.
Because they seem to follow each other. And a lot of things that we see are patients that come in with the itchy red eyes, the runny nose, the sneezing, the constant coughing, worse at night when they lay down. And generally what we like to use is we like to use a non-drowsy type antihistamine for those allergies. And the good thing about that nowadays is you have some very good ones that are over the counter, including your Allegra, Zyrtec, and Claritin. And we still have the old favorites of Benadryl, but generally that'll make you a little too sleepy to function your jobs and so on. We like to try the antihistamines first, and then if indeed that's not clearing up the allergies, then we may use something like a nasal type of topical steroid or something of that nature.
Now, you did talk about an antihistamine, and
Yes.
we as consumers get very, very confused. They're the antihistamines, and then they're also decongestants.
Yes.
So, I mean, when we're going and we're getting these over-the-counter things, of course, we're trying to look to see which one we are to get, and some have both in them, and
Right.
some have, you know,
Right.
what are the distinctions between the decongestants and the antihistamines?
The antihistamines are, they work on the histamines that are released from the body because of the allergen. So those we use more for allergies, where your decongestants are more for the cold type symptoms. You know, decongestants can kind of basically open things up and dry things out.
Okay.
Okay.
Okay. So you look for those distinctions. Now, you're talking about using the over-the-counter antihistamines in terms of treatment with allergies, like if you have really severe eye reactions.
Yes.
Is there ever a time when you look at a prescription? Because once again, as consumers, we want to go to the doctor and get a drug.
Absolutely.
You know, so is there ever an appropriate time for that level of intervention?
Absolutely. You know, anytime that you use an over-the-counter histamine and you continue to have symptoms, I would recommend that you do follow up with your primary care provider, because there are also allergy type eye drops by prescription that we can use.
And I do know in a previous program that we did with your CEO, John Silva, he did mention even at Morton that you do have ophthalmology kinds of services. So people can go in and get their eyes checked and follow up in that arena if they wish.
Yes.
Now let me ask you another question, because with this allergy thing and the sinus thing and people that have chronic sinus problems, it seems, do those always have to be allergy related, or how do you determine if it's allergy or there's some other underlying medical condition or infection or something that may be happening?
Generally from a physical examination, kind of talking with the patient, getting a thorough history, and doing examination and basically looking, you know, assessing of what the nasal discharge look like. You know, is there facial swelling? Is there pain over the sinuses? Is there fever involved? And, you know, sometimes there may be some imaging studies that may be necessary to determine also.
Okay.
Okay, and even realize that even your allergy, you know, regular allergies sometime may progress into a bacterial sinusitis or other type infections, ear infections, and so on.
Okay, well, when you mention that, then sort of if an allergy is going to progress into a bacterial infection, is that because you're not treating the allergy symptoms, and so the stuffy nose you may have and things like that just get clogged up and stuff just gets stuck there?
Exactly.
And then the bacteria starts to grow?
It starts to grow because the body is naturally warm, so, you know, you're going to have bacteria that grows. If you can think about it, you know, you have this running of the nose from the front, from the nose, but also in the back, and if things are kind of shut down and that fluid becomes stagnant, then yes, you know, you can grow bacteria and it can lead to something else.
Okay, so it is important to address allergy issues, especially when they become problematic for you, so it doesn't progress into something else.
Exactly.
Now, let me ask this question about allergy shots, because sometimes, of course, allergies can be triggered by just the general environment, but some specific things, whether it's grass or horses or you name it. Do you provide allergy shots, and then what is the percentage of success? I mean, do they really work? So sometimes we think you just want to stick us once again, but it's not going to help a thing. So
Actually, in actuality, in our particular clinic, when we determine that, you know, the allergy, that your allergies are not getting bad, we would actually refer you to an allergist. Specialists themselves who can test you for a group of things and kind of determine what it is that's causing the allergies, and then of course get into the allergy shots. So allergy shots themselves are not something that we kind of do at Morton.
Do it Morton, okay, but you do the referrals.
We
and
do the
work.
referral, absolutely.
And one really quick question before we take a break. Should we sort of self-medicate with over-the-counter things if we feel like we've got an allergy going? Can we start with some things, and if that doesn't work, then see the doctor? Or should we always go to the doctor and say, what do I need to do?
No, I think it is very appropriate that if you're having a runny nose, you're not having a fever, it didn't come up all of a sudden. This is something that happens every year. Is to try an over-the-counter allergy medication, and then of course after a week or two, if it's not working or symptoms seem to be getting worse, then definitely come and see us.
Okay, all right. Stay put.
All right.
And you stay put. We'll be right back. Welcome back to continue our discussion talking about general issues of health. Joining me again is Michael Montague, a physician assistant with Morton Comprehensive Health Services. Let's jump in.
Okay.
Now I want to switch to looking at the area of men and men's health, because so many times men feel that, I guess, they don't really get ill, or if they do, it won't be that bad.
Right.
So let's talk about in general, like a physical for men. How often is it recommended, and what is involved in this physical?
Yes. I recommend to my patients, especially over the age of 40, a yearly examination. And that is to include some basic screening blood work, okay, to check the renal function, kidney function, cholesterol level. And then at the age of 45, for African American males or a male who has a family history of prostate cancer, to get a PSA. A prostate enzyme, and also to check the prostate once a year.
Okay, now the PSA, people are like, okay, how do I get my PSA checked? What
Right.
does that involve?
The PSA is actually a blood test.
Okay.
Okay. That we can do in the outpatient setting, and follow that up with a digital rectal exam to check the prostate.
So that PSA is giving you some indication of the level, and if it's above a certain level, that looks suspicious.
Exactly, and it should be monitored and watched, and maybe even referred to a urologist.
Okay, okay. So you're encompassing that. Now, should males look at, as a part of this yearly physical, eye exams and dental checks?
It's always
and,
it's always a good idea to get eye exams. And also see a dentist just for your overall wellness and for preventive medicine reasons.
Okay, now, and we've heard this in the news media in relation to children, and tell me, have you seen any of this in your practice for people who are failing to get maybe abscesses, dental abscesses addressed, or look at their dental health, end up with some severe bacterial infections or other kinds of things going on that medically now need intervention? And it all resulted from the lack of dental intervention for problems that they were having.
Right. We don't see a lot in our particular practice, but that is possible that a tooth abscess can move up into the sinuses and so on, that can become medical type problems. Even the bacteria from your gums, if it can affect your overall system, including the cardiovascular system from that bacteria being in the mouth. So it's always a good idea to see a dentist and to have that evaluation.
Okay, now let me ask this other question. Males, for instance, for females, and I mentioned that to you on the break, females over 50, you're always told that you shouldn't take iron any longer, that is not advantageous to you. Are there certain kind of criteria like that for males after a certain age, that there should be some adjustment in the kind of intake you're doing, whether it's iron or anything like that, or increase or decrease?
Right. Generally, for males, we like to kind of individualize things. I think a good multivitamin would be good for the male, but certainly individually, like I said, get those annual physicals. Let us review the lab work and make those recommendations.
Okay, so you can actually see if your cholesterol is elevated, which type of cholesterol, because there is, as we say, the LDL, the lousy, and the HDL, the happy.
Absolutely.
So you want the lousy to be low. So to see what's really happening to make the adjustments in the diet or exercise that might really be needed.
Correct.
Okay, now let me ask you about younger males, because you talked about men, at least in their 40s and greater, having a yearly physical. What about younger men? What's the recommendation there? Can they go every couple of 3 years?
I think usually for your younger males, generally 2 to 3 years. They can go without a physical, provided you know, their family history. You know, certainly if you have a family history of diabetes, you have a family history of heart disease, you have a family history of hypertension, you generally want to get a physical examination probably a little more often. And you know, when you're making those trips to Walmart or Walgreens, maybe stop and take your blood pressure if you have a family history of hypertension. And kind of keep an eye on these things.
Yeah, and I did have a physician that was on the show previously that talked about if you go to places like that, make sure that you sort of wait a few minutes. Don't just rush right in from the heat or the cold and put your arm in there, because the reading is probably not going to be accurate.
That's correct. And if it is a little on the high side, I even recommend wait a few minutes and take it again.
Okay.
You know, and kind of get an average.
Okay. Now let me ask about then the younger males too with sports.
Yes.
And this concept of a sports physical. Should everyone who is engaged in a sporting activity, male or female, should they have a physical prior to that? I mean, how does that work?
Yes, I think that you know, prior to sports, certainly you know, high school sports, that they should have a sports physical, which kind of includes a general physical examination and reviewing their medical history prior to participating. And most of the public school districts here in Tulsa will require that.
Now, we've heard of some kids that have had sudden cardiac events, not a lot. Should it also involve getting a chest x-ray or EKG if you have some history or you're having some problems? I mean, should it be a little more thorough depending on what the child's history or what they're presenting with?
Absolutely. We do review, and you know, like I said, the family history and the patient's history, and if warranted, and also the physical exam, if there's any findings there, heart murmurs and so on, then we will do not only the EKG, chest x-ray, but maybe even a referral to a cardiologist before that person is approved to participate in those sports. Okay,
and another question too. People that have, and kids or even adults that have asthma and situations such as that, are there limitations that they should be aware of in terms of sports or outdoor activity, or can they participate fully? If so, under what criteria? Tell me a little bit about that.
Well, you do have kids that may have an exercise-induced asthma, and then they can participate in the exercise, and sometimes we may require them to use an inhaler prior to participating. Okay. But again, if indeed it all depends on that particular individual, how many flare-ups of asthma that they may have, and basically the severity on participating. But generally, if you do have asthma, I do recommend that you see your family provider prior to participating in those organized sports.
Okay, and that would be the same thing for an adult, you know, because sometimes as adults we think, oh, I could go out here and just play some basketball this weekend and it's almost 100 degrees. And you've never played before, but you think you used to, so you can get right back into it.
Exactly.
And you really shouldn't do that unless you really know your health status, because you can be putting yourself at greater risk.
Absolutely. You can not only put yourself at a greater risk, for heat injuries, you know, and you know, that sort of thing. So you definitely, even as an adult, if you have a history of high blood pressure, you have a history of heart disease, is to visit your provider and talk with them about that prior to just jumping back into sports.
Okay, we're going to come back and talk a little bit more about these heat issues. So stay put again.
All right.
We'll be right back. Welcome back. To complete our discussion, talking about general issues affecting health, joining me again, Michael Montague, Physician Assistant with Morton Comprehensive Health Services. Let's jump right in here now. Heat.
Yes.
Let's talk a little bit about the risks that we encounter related to heat. I mean, tell me a little bit about this heat exhaustion and heat stroke and heat cramps, and there's all kind of heat things.
Absolutely. And during the summer months, or these days where we have a high heat and humidity, that increases the chance of heat-related illnesses. Those can be something like heat cramps, where you're basically, not getting enough fluid in and sweating and being out in the heat. To go into heat exhaustion, where you may start to have some fatigue and weakness, feeling a little dizzy while out in the heat, sweating profusely while in the heat. And that going from heat exhaustion, and if you're not taken out of that environment, it can move on to like a heat stroke, where the body core temperature can go up above 104 degrees, and you have some actual central nervous system disruption.
Now, if we are out in the heat, or we see someone who's being affected, at what point should we look at emergency services being needed? I mean, does the person become very disoriented, incoherent, skin hot? I mean, where should we start treating this like this is an emergency?
This is a heat type injury is an emergency anytime that person starts to, let's say, become dizzy, that particular person become a little lethargic or confused. You want to get that individual out of that heat and activate the EMS system. Okay. You want to start down the cooling process. All right. Obviously, if a person's in a coma and so on, you definitely want to, activate the EMS system.
Now, in terms of calling 911, then, in terms of trying to help cool, you're saying start the cooling process. Should that be, if we have access to ice, putting ice on them? Is it just really cool water?
Right. Certainly, loosening the clothing, getting them out of the direct sunlight.
Okay.
If they're talking with you and seems to be alert to, offer the water, get them into shade. Open the clothing up. Kind of missing them down with a little water may cool them down.
Okay, so anything that you can do to start lowering that core temperature while help is on its way.
Absolutely.
Now, you talked about water when, we're not taking in enough water, et cetera. And in all honesty, for me, for instance, water is a challenge. I mean, that's why I do like the bottles, because I can see how much I really did consume.
Which is very good.
But how much should we look at consuming on a daily basis? I mean, we've heard 6 to 8 glasses. We've heard 8 to 10 glasses. I mean.
Well, let's talk about that bottle that you're talking about. I think that's in our society now, you can kind of measure that. Most bottles are about 16 to 20 ounces, unless you're getting the deluxe type
Sometimes
bottle.
I get the deluxe.
Yeah, right. But let's talk about this. Let's talk about the 16 to 20.
Right.
I would say about 4 to 5, 20-ounce bottles of water a day would be a good amount of water, unless you're getting out and doing some type outdoor activities.
Okay.
Then you may want to increase that also.
And then taking frequent water breaks if you're outside, especially when we think about youth with training for sports and things like that. It's imperative that they have the frequent water breaks.
That's absolutely correct. And even the younger kids, you have to keep in mind also, to have hats, to prevent sunburns. Young kids and our older adults may have sunburn a little quicker than we do. And of course, a good sunscreen will also help.
And I'm glad you mentioned the sunscreen, because that's sometimes something that we don't think about.
Yes. And
I must admit, and this may sound stereotypical, but it seems like men think about sunscreen less. If you say you need to put some sunscreen on that, I don't need that.
That's right.
But men need sunscreen too, because skin cancers are real, and they're growing because of the exposure to sun and the lack of protection and exposure to sun tanning beds as well.
Yes.
Okay.
You're right. You're absolutely correct. And that not only men, but even African Americans may feel they don't need sunscreen.
That is a very good point, because sometimes they feel that you don't tan because you already are darker complected and the sun doesn't bother you, but that is a myth.
That's right. We all know.
Yeah, that's a big myth.
You just need to stay outside in Tulsa for about 3 to 4 hours, and if you have a shirt on, you can see the difference in the skin tone, and even that burning and stinging type sensation to the skin.
Right, and that's imperative. Now, the type of sunscreen in terms of the sunscreen levels. You know, they
Yes.
got 20, they got 25, they got 30, they
Right.
got 50.
Right.
Is there like a standard that if you get at least this and for the UVA and UVB protection, that is going to be sufficient?
No, I like to say, you know, the higher the better.
Okay, okay.
The higher the better, because those standards are usually we don't put on enough sunscreen at a time to meet those standards, or reapply it
Yes.
enough to meet those particular standards.
And I think
Okay.
that's an excellent key that you make too, because if you read the labels, and I
Yes.
use sunscreen religiously,
Okay.
but if you read the labels, they do tell you about when to reapply.
That's right.
And so sometimes people think, well, I put it on in the morning and I'm good for the rest of the day.
Absolutely.
But you may have to carry some with you, and they do have the smaller ones. You can get the smaller little tube things that you can pour it into or something to reapply as is indicated, or else you're not getting the protection that you need.
Yes, and nowadays they have a lot that they say are water resistant, or they last longer. Well, please read the label, because those also need to be reapplied.
Yes, and I do want to mention too, not just in summer months, but even in the winter time, the sun is out.
Yes.
And we don't think it is. It's not as intense. But you might want to consider using sunscreen all year round. I mean, it's not as intense, but you're still having some exposure. And especially for people who drive and their arm is hanging out the window.
That's right.
Have you
Right.
seen that? You're
Yes.
wondering, I always do they have sunscreen on that arm?
That's right.
And they very well may not. So we need to really consider our whole method of thinking about sun and sun exposure and protection.
Absolutely. And generally in the winter months, though, you know, we have outer garments or long sleeves, and we tend to wear more hats.
Tend to wear.
Tend to wear.
But that's a good thing, especially with kids. I want
Yes.
to reinforce that once again, because sometimes we don't think about our children. We think they're like we are, but their skin is a lot more sensitive.
A lot more sensitive, and generally they can receive sunburns a lot sooner before you notice your own.
Okay, and I do want to reiterate too, and have you talk about just really briefly, leaving children in cars unattended with
Yes.
the window cracked a little bit while you're running to the store for a minute. Absolutely never,
Ever.
never, ever do that.
Ever, under any circumstances.
Okay.
Generally, the temperature in those cars can raise that body temperature up over that heat stroke level that we had talked about earlier of 104 degrees very quickly.
Exactly, and kids, their temperature regulation is not very developed anyway. So
Absolutely.
theirs can soar a whole lot faster than ours would tend to soar.
Right. And I would also like to add, don't leave the pets.
Yes.
In
Bring
the car.
Fido in with you, or leave him at home.
or
in
leave
a,
him at home.
Yes.
Absolutely.
Yes, and Fidette too for the kittens.
Yes.
Or the other people. Yeah. You have to protect your animals.
Yes, you do.
Thank you so much for joining me.
Thank you so much for having me.
Well, that's our show. For Health Alert, I'm Pam Butler. I'd love to hear comments, questions, or suggestions for future shows. Please write me at Health Alert USA, P.O. Box 50913, Tulsa, Oklahoma 74150. Or if you're on the email trail, please email me at healthalertusa@gmail.com. And also visit me on YouTube at youtube.com/healthalertusa. And remember, pay attention to your body, get the physicals that you need, especially you men, and also don't expose your children to heat and things that are just not good. Take care. Health Alert is brought to you by OU Physicians in Tulsa.